can't sleep because of shoulder pain, can't even let your arm hang by your side because it starts to throb? Well, that was Randall during our first session. And now he's outside throwing baseballs with his son. He is pain-free, he had to have no surgeries, and he didn't have any injections. When Randall came to see me, he had a severely injured rotator cuff. Again, just letting that arm hang for even a few minutes was unbearable, so he was constantly having to hold it. He couldn't lift that arm out to the side very far, and he couldn't hold anything away from his body. At night, it was even worse, because he couldn't sleep. If he found a position that sort of worked, the moment he rolled over, boom, pain comes back and wakes him right back up. Now, one can imagine, after several weeks of not sleeping, he got super moody and very short-tempered. That's when his wife finally got fed up and handed him my phone number and said, please call this clinic before we all lose it. I'm sure many people can appreciate that. Like many people, Randall had been trying to push past all the pain he was dealing with ice, massage, resting it, and he figured that eventually it would just go away. But unfortunately, it just got worse. And what he was really worried about, that he didn't tell anybody about before, was that he thought he might have to have surgery, and that would be his only option. And he didn't want to deal with taking the time off of work, the endless doctor's appointments, and being weeks in pain on top of being restricted. So all he wanted to do was to be able to work out, play with his kids, and feel like himself again. So he waited. But that was until his wife. So now we're here during our first eval, and I was able to tell him what was going on with his shoulder. Basically, that bone, the arm bone, when it was being pulled up, the rotator cuff wasn't doing its job, and so it was just jamming the arm bone into the shoulder, which just continuously re-irritated that tendon. Now, what I was able to tell him, and I'm telling you, is that the good news is all of that is completely fixable. And that's what we started with. We started with hands-on care, we started with specific exercises to reduce his pain, and we started getting his shoulder moving better. Once that happened, we were able to shift our focus to rebuilding the strength, improving his posture so that his shoulder would work the way that it was supposed to. And now, fast forwarding a few months, Randall is sleeping through the night, he is working out again, and the best part is he is able to play baseball with his son. He's able to throw those balls, and he's pain-free. If you've been told that your only option is injection surgery, or maybe you've simply just been dealing with this shoulder pain for way too long, I want you to know that most rotator cuff injuries can get better without surgery, but it takes the right plan and somebody who is actually paying attention to your specific situation. So if that sounds like what you're looking for, I'd love to help. Check out the comments below for a link to my clinic where you get to pick the contact option that works best for you. I hope that you're having a good day.